Oh yeah, I think she let me know. Okay. Perfectly fine. No worries. We'll get started in just about a minute in case we have any people coming in or anyone joining on Zoom that's still connecting their audio. So we'll get started. If you guys don't have a salad or water already, salads and water along the back wall or the side wall. We'll go ahead and get started. I think we're good. All right, welcome everybody. Welcome to the August Buckeye Wellness Lunch and Learn. Thank you all for joining us. For those who are here in person, great to see your faces. Those joining online, it's great to have you here as well tuning in. I'm Nicole Johnson. I'm the program coordinator with Buckeye Wellness out of the Office of the Chief Wellness Officer. I'm going to quickly go over a couple of upcoming events that we have going on. So our next Lunch and Learn for September will be on the 23rd, and it will be a cooking demo. We're going to have healthy fall comfort food, so some healthy twists on those. So that'll be really exciting, and it'll be the same setup. We'll have in-person as well as a live webcast option for those who aren't able to be here in person. Our next Buckeye Wellness Innovator Orientation is on October 4th. Do we have any in the room who are innovators or online? Can you raise your hand? Okay, awesome. We got a couple in here. So if you aren't familiar with what a Buckeye Wellness Innovator is, it is essentially a wellness champion for your department, someone who's very passionate about wellness. They want to bring wellness to your department and with different programs, activities, communications, really great program. So if you're interested in that, the application, I believe, is up live now. So you can recruit some colleagues, join yourself, and become an innovator. Next up on October 13th, we have the Amazing Race to Wellness. If you aren't familiar with what Amazing Race is, it takes place on the South Oval, and it's where teams of 4 compete and race around the South Oval, and they complete different stations. Each station focuses on a different dimension of wellness, or is just, a fun little wellness activity to do. So it's a great event to come to, boost team connection, be outside, enjoy some fall weather. It's a lot of fun. So I can send out the link after in the follow-up email with the link to get registered for that. And then our continuing programs, we have group fitness classes going on. We have some Monday through Thursday, some are in the morning, some are at the lunch hour, and some are in the evening. So hopefully there's one that fits your schedule and you can join one of our fantastic fitness instructors. So now during the presentation, for those on Zoom, if you have any questions, go ahead and put them in the chat as we're going through. And at the end, we'll have some time and we'll go through them there. And everyone here in person, you can hold on to your questions. We'll get to them at the end. I'll introduce our 2 wonderful speakers that we have today. First up is Dr. Inga Zadvinskis. I hope I said that correctly. She serves as the Assistant Director of the Community Core at the Fold Institute, where she focuses on promoting evidence-based health decision-making for the public community. Inga is a former medical, surgical, and ICU staff nurse and adult health nurse practitioner. She earned her PhD in nursing at The Ohio State University College of Nursing in August of 2015. And next up, we have Dr. Jacqueline Hoying. She is an assistant clinical professor at the College of Nursing and director of the MindStrong program. She also serves as the director of the Community Core at the Fold Institute, where she inspires a promotion of evidence-based health decision-making for the public. A behavioral intervention researcher, Dr. Hoying studies interventions to promote overall health, well-being, and mental resilience. And with that, I will pass it over to them. Get your slides up.
Thank you, Nicole. It is a thrill to be here. So good afternoon. And Inga and I, Dr. Zadvinskis, are delighted to get to spend a little time with you, talk to you about what you're here for is health misinformation and what are we going to do about it. So what's our responsibility? How do we discern that? We're going to go through that. And we hope by the end of the presentation, you're able to at least identify one way that you would address health information. Certainly, I'm sure many of you get asked multitude of questions, right? People are wanting health information from you. We don't have any conflicts of interest and there's no financial incentives, so that's all good. And so today we're going to talk a little bit. I want to introduce the Fold to you if you're not familiar with the Community Core. We're getting the word out on what we're doing and define what consumer health information is and personal health literacy. So we want to talk about that. And then we want to get into looking at the differences between health information, misinformation, and disinformation, what the differences are, and what's the consequence and some of the outcome that we've seen in health outcomes as a result of misinformation, and then explain how it spreads, and then discuss how to respond to health misinformation. So you may be familiar with the Helene Fold Institute here at the university. The Fold was started in 2016. It was a $6.5 million grant that was received, largest grant the College of Nursing has received to date. And out of that came, and the Fold's really gaining national presence now. It's becoming a hub for evidence-based practice and how to disseminate evidence. So there's 4 cores. The first one's the clinical core, and that recognizes clinicians and works with them with evidence-based practice. And then there's the academic core that works with students and academicians to talk about health evidence and what that looks like. Implementation science core takes research that's published or at benchmark at the bench and moves it into practice, disseminates it. And then there's the community core. So we're the last core to come up. We have been ardently working for, I would say, the last about 2 years, and we're making some great progress. But I want you to know a little bit about what we are. So we are health evidence for everyone. We want to improve public health through evidence and to help people use evidence in practice and making their own health decisions, whether that's a family or an individual. And we want to be a leader in driving the evidence-based decision-making for the community to improve health. So what is consumer health information, right? It's looking at anything that's health, medical, conditions and medical topics for the general public. And it's written at the lay level so that it's easily understandable and digestible so that the person that is reading the information can understand it. Personal health literacy has taken on certainly coming to the forefront of what's important, and we're looking at it too. And that's the degree which individuals have the ability to understand and use the information and services to inform their health-related decisions. So do they understand it? And it's for the actions for themselves and for others in their family circle. The new definition, though, moved from appropriate to well-informed decisions. So our goal really is that people are well-informed. They can have all the information. The decision is still theirs. And so we just want them to have the best evidence and able to make that decision. So where do you think people go for health information? I'm sorry. Google. 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 Everybody's nodding. Where else? Dr. Oz. I love it. Yeah. Friends, family. Yep. Someone who has the condition that you've just been informed about, right? So we know that about 70 to 80% of people have searched for health-related medical information online. About 60% have talked about that it's frustrating to find the information and to understand the information. And looking at the sources, so you identified those, right? The search engines, Google, Microsoft, websites, WebMD, right? Medline Plus, And then health professionals, certainly your primary care provider, seeking out the expertise of the nurse who's the neighbor next door, and family and friends, right? You identify that, community groups, and then church organizations or people that you know that way. And then social networks, right? So Facebook, Twitter, TikTok, and other people who have the same health conditions. So you might belong to a listserv or a blog that gives you information. And then there's public library and librarians. And I would be remiss if I didn't share with you that OSU Wexner Medical Center has their own health consumer librarian. Her name is Missy Creed, Creed, and she is an amazing human. She sits on our board for the community core, but she's an amazing wealth of information for consumers. So let you know that that's available in here. But when you think about health misinformation, and you think about the outcomes from that, what are some things that happen? So we know one thing happens is your worry increases. You may not be fully, don't have all the information in front of you, but you've Googled just enough to make yourself really concerned. Tension with family members. The online information may say one thing and the family feels differently about that. So a little tension there. You may postpone seeking help for the problem because you think now you know what it is. And spending money on those non-beneficial, wonderful ads that get people to think that this may be something that may help me, and there's no evidence, and not following the healthcare management plan. So it may cause you to go down a different path that you might not have done had you not seen that information. So if I ask the question, misinformation or disinformation, do you feel comfortable that you know the difference? See some nods yes, and some people are saying no. Okay, so let's just take a quick look. Health misinformation. It's health-related a claim. It's a fact. They claim that it's a fact, and it's currently false due to a lack of evidence. So that's misinformation. It's false, it's inaccurate, it's misleading. And according to the best available evidence, and I'll say at the time, right? We certainly saw how that happened with COVID, right? As new evidence came up, the protocols changed. It caused people to say, well, what's going on? But if you understand the science behind it, you could appreciate where they were and how fast they were running. And then what is disinformation? So the definition of disinformation is that it's purposeful. And that's really what I want you to hear. When I hear disinformation, I think deliberate. The D for me is deliberate, of spreading misinformation. So it's intentional. So when you look at the differences, misinformation is false and incorrect, but it's not created intentionally to do that. Where disinformation is intentional and it's developed to intentionally spread wrong information. And why would someone do that? Like, you think about that? Well, they gain power, can get a following that way, money, and a reputation is becoming that person or that entity that has the information. So I thought we'd spend just a minute and look at some consequences of outcomes from COVID-19 that were related to health misinformation. And the science, I know it's hard to read that, but on the PowerPoint, you can see the citations for all the science. This is obviously evidence-based. So declines in vaccinations, COVID-19 vaccinations occurred, rejection of public health measures that were known to improve people's protection, such as masking and physical distancing, and the use of unproven treatments. So those things happened. And then information spikes. So they were called to the Poison Control Center. They could measure the spike of the increase in the calls that were associated with health misinformation when it was posted or it was on social media about using household cleaning agents to treat COVID-19. Interesting, right? And then, unfortunately, the death of the husband and wife who took chloroquine to prevent the coronavirus, and they died from that. So how does it spread, right? There's trolls, if you're familiar with that term. They're paid, and they're paid to produce fake content. And then there's bots, and that's an automatic account that promotes the misinformation. So it keeps generating it. And then there's unwitting agents, people who are unaware of their role, but they increase or exaggerate the incorrect message. They're not aware that that's what they're doing, but they like it, they spread it, they repost it, they share it, right? All those things that cause that misinformation to get spread. So why are people tempted to share health misinformation? I like to think that they don't know that they're doing that. But it feels good, right? To have information. You have information and someone else doesn't. It feels good to share that. To protect people you care about. I'm sure you can think of a situation where you're like someone that you love and you're like, did you know? Did you know this is going on? And it may be misinformation. We may want to provide explanations, fill in the story, if you will, to make sense of the events that are going on around us. So you can probably think about times when you didn't have the facts, but you wanted to fill in the story, right? So you create your own story, and then wanting to connect with others. So it is a way to feel tied in, right? All right. With that, I'm going to turn it over to my good friend, Inga, and she's going to take over with origins of misinformation and how it spreads.
You on? Now it is. Okay, good. So we're going to talk about the origins of misinformation. We found a really fun video for all of you on YouTube. So I'm hoping if I advance that will work. Oh, maybe not. I'm trying to see if I can get it up here. Okay. We're going to have to scratch that. Sorry, I guess it worked at home. So yeah, we will send out the link later. What I will tell you about it, it's a fun example of how health misinformation was spread. They use an example of a llama, and essentially that there's an assumption that because someone has a llama for Congress poster on their car and their car gets egged, they assume it's a political statement against llama for Congress. Obviously, this is a made up example. But then what happened was this was put on social media. There were a ton of likes. There were posters in the neighborhood, and this information began to get spread. So it's an example of how misinformation can be spread. So it's a lot of fun. It's 5 minutes. So we'll send you the link so you'll have an opportunity to take a look at that later. Well, we can talk about a couple of the key points from the video that if you're going to take something away, the main thing is, first of all, to remember to be empathetic when we're talking about health misinformation. People want to connect with others. That's really the whole reason for social media. Jackie already talked about that a little bit. And then before going on social media, hitting like, responding to something, make sure you slow down, verify the source of the information. Is it indeed evidence-based? Is there a citation? Take a look at who constructed the information. So those are kind of the two key main points from that video. So whose responsibility is health misinformation? Well, our US Surgeon General, Dr. Murthy, he called misinformation that it's really, it's a danger, and he has asked all Americans to respond. So there's a specific quote that I thought was very articulate. He says, health misinformation is a serious threat to public health. It can cause confusion, sow mistrust, harm people's health, and undermine public health efforts. So we are all responsible for health misinformation, whether you're a consumer, whether you're a healthcare professional. In fact, the US Surgeon General, they have developed an entire website dedicated to health misinformation. So this is a fantastic toolkit we wanted to make sure that all of you had. It's free. It's a community toolkit for addressing health misinformation. Great resources on there. And they have a one-page summary for you as well as the booklet. So we'd encourage all of you to take a look at that website. How many of you here are nurses? You have nurses? Yeah, a few nurses. So what does the American Nurses Association say about health misinformation? So over a year ago, actually, US Boards of Nursing, they had posted something. And basically what they're telling us is that our boards of nursing, we are responsible for health misinformation. US boards of nursing, the profession, and the public, they expect nurses to uphold the truth, right? We also have to follow our nurses' code of ethics. We also have to follow scientific standards for disseminating information regarding COVID-19 or frankly, any health condition for that matter. And specifically, almost a year ago, back in November, they put out a statement, and I'd like to read it because it's pretty significant for all of us that are nurses. Any nurse who violates the State Nurse Practice Act or threatens the health and safety of the public through dissemination of misleading or incorrect information pertaining to COVID-19, vaccines, and associated treatment through verbal or written methods, including social media, may be disciplined by the Board of Nursing. So this is serious stuff. If you hold a professional license, you're held accountable to that, whether or not it's a personal account. So you're an RN, you have a license. So be aware of that. This is not just limited to nurses. What about our physician colleagues? What about the American Medical Association? What did they say about health misinformation? They just met actually in June. They had their annual meeting of the House of Delegates and the AMA, so they adopted a policy. And they developed this policy that really targeted a number of stakeholder groups, including social media and publishers, state licensing agencies, our credentialing boards, and all these things. And all of these various organizations and groups are all responsible for addressing health misinformation. So we certainly have an obligation based on our professional organizations. How about some resources? How can you help fight health misinformation? We've already talked a little bit about the US Surgeon General. That's a great website that's available to all of you. There's also nursingworld.org, and they actually have an entire site that's called COVID-19 Evidence as the Basis of Decisions. And of course, we all want to practice using evidence-based practice. We also wanted to share with you this Public Health Communications Collaborative. That is a fantastic website. It's free. And the screenshot here, you can actually type in your email. And what they do is they go scour and look at health misinformation posts on social media, and they determine how it was altered, how the message was altered, how the image was altered. Really effective. They only send emails maybe once a week. But for those of you that are interested in this topic, I would highly recommend signing up for that. It's really helpful to keep up to date. So to give you an example of what that might look like, probably all of us now have heard about monkeypox, right? That's the latest thing that's in the news. So this is a screenshot from something that the Public Health Communications Collaboration that they had developed. And what they had done is they took a look at something that was posted and they determined how this image was altered and what makes it misinformation. So it's really helpful if you hear something, if someone comes to you and you're like, I'm not sure if that's entirely valid. This is a great resource that's available to all of you. We knew all of you would be asking us about which websites, right? We already talked about a lot of people go to Google when they look for health information. So we took an evidence-based approach. There was a study, there were some researchers that took a look at this. And what they had done is they had designated what they were going to search on the internet for, and they looked at the top 5 most popular websites. And then what they did is they evaluated those consumer health websites using specific instruments that were valid and reliable. That's important for us when we're talking about evaluating the quality of something. So they used this instrument called Discern. It's an acronym. They also used the unfortunately named CRAAP instrument, which may help identify incorrect information. So both of those instruments are publicly available. And in addition, there's also something called this HON code. It's an acronym. And this is a specific organization. Their entire reason for being is to go look at these consumer health websites and determine whether or not they're trustworthy and credible. So this particular study, what did they find? The most reliable free consumer health website was Medline Plus. So that is, if anybody asks you, where should I go for health information? We would refer you to Medline Plus. Also nice to know that our consumer health librarian confirms that. So that's always helpful because that's her area of expertise. But the research does too. What about other websites? Probably some of you, of course, have heard of WebMD, right? That's also available to you. That also has that on-code certification. So it's credible and trustworthy. Only caveat, sometimes with consumer health websites, they will have advertisements. So that's something to be aware of. They should be clearly marked advertisement but that can be a little bit confusing. If you're looking up high blood pressure or hypertension and their drug ad pops up, someone could misinterpret that that is best practice to treat that condition. So just something to be aware of with some of these websites. So WebMD is available. Of course, we have the Mayo Clinic, Healthline, and Medical News Today. So those are all trustworthy and credible consumer health information websites for you that you can use. So what are 3 things that health professionals can do to fight misinformation? Well, first, we can proactively engage with patients and the public. So if you hear something that doesn't sound right, engage in the conversation. We're going to give you some tips about how to do that because that can be a little bit tricky. The other thing, if you're on social media or you use technology, share accurate information. When someone asks you for information, make sure that it's accurate, that it's trustworthy, and that it's evidence-based. And then the third thing you can do is to partner with community groups and other local organizations. So for example, like us at the Community Corps, you can come partner with us. So we'd be delighted. Sometimes when someone comes to you and you're taken off guard, you're not necessarily confident. How should I respond to this? Someone tells you something that your instinct is telling you that's not correct. It's health misinformation. How can we respond to that? We have some strategies. Sometimes it's helpful with scripting just to have something in your head. So the first strategy is really to listen. Try to understand why they believe what they do. So they tell you the misinformation, you say, can you tell me more about where you heard that? Figure out maybe what the source of where the website was. Where did they get that information? And then if you can delve a little further, ask them, it sounds like you might be concerned about, and then you fill in the blank. But engaging in that conversation and really listening, really listening. We've already heard a couple other times in this talk, empathy, how important that is. That people really, they want to connect. That's the whole reason for posting things usually on social media. So express that you understand that people find it difficult to be able to trust certain sources of information. So you might respond by saying something like, it can be hard to find trustworthy information. It is true that research is continually being updated. I know that that's challenging for me, just trying to be up to date in your practice. So especially in the context of what we've all just lived through with the pandemic, there was a lot of changing information. You could also identify the feeling, what the person's feeling. You sound anxious about X, Y, or Z, and fill in the blank. And then lastly, can I help you find trustworthy information? Have you considered looking at Medline Plus? Is there another website you might look? So these are different ways that we can respond with empathy to health misinformation. It can be tempting, but we don't want to publicly shame anyone that posts health misinformation. If we can, try to have a one-on-one conversation privately. We can do that. So one way to approach that, can I talk to you sometime? Call up, pick up the phone versus doing something online. Or respond saying something like, I wish there was an easy solution for X, Y, or Z, but I wonder at the people about the website, what's their motivation for posting that? So for example, some people post things they're trying to make money. They also might be trying to support a certain person or a cause. They also might be trying to steal your personal information. Sometimes websites, they want you to plug in your email address. Well, they'll go off and sell that. So something, or your IP address. So there can be reasons why people post that health misinformation. Another strategy for responding is to use inclusive language. So for example, use phrases like we and us, that we're all in this together. That can be really effective. So responding, I hear what you're saying, even if you believe maybe that it's not necessarily scientifically valid, but I hear you. I hear what you're saying. I've been confused too about that. I've seen that poster website too. And you can go to the Public Health Collaborations website and determine why it was altered. Maybe you can find that. And then lastly, bring it back to evidence-based practice. I wonder if there's evidence to support what they're saying on that particular website. So bring it back to the evidence. Jackie talked a little bit about the consequences of health misinformation. We know that we're all responsible for it. By you taking time today, we've talked a little bit about the differences between health misinformation and disinformation. We've talked about some sources of that. We've provided resources for you, where you can go for different websites. We've also provided some scripting because sometimes that can be difficult to respond. Health misinformation can have major consequences. If we think about the story that Jackie had shared, the gentleman that took the chloroquine for treatment of the COVID-19, he died from that, and his wife went into the ICU. Very, very severe consequences. And I'm certain if we could have a conversation with that gentleman's daughter or his granddaughter, he would really wish, boy, I wish someone would have talked to my dad about that. Have that conversation. One good conversation can shift the direction of change forever. That person would still be here. So it's important for all of us, whether you're a healthcare provider or just a member of the community, have that conversation. This is important. This is important. So how can you find us on the Community Core? There's our website up here. When you get to the homepage of the Fold Institute for Evidence-Based Practice, we have our 4 cores listed. Click on us on the community. We do have some resources specific to our community core that we wanted to share with you. We have a podcast. We were so thrilled to be invited to be able to do the podcast here with here in nursing for all of you at OSU Medical Center. So that literally just came out. You can get CEs for that, and it's about 24 minutes in length. So maybe put your earbuds in, go for a walk, and come listen to us again. So we also want to advertise that we have a pre-conference that's coming up for the community, for the public. So we're really excited. The Fold Institute, Jackie already talked about the different cores, and we are going to have a live event where we're going to invite the public to come talk to us. And so we're very excited about that. Will be on May 24th of 2023. So we're super excited about that. We've been working very hard with our planning committee to ensure that our content reflects their interests. What does the public want to hear? So we're very excited about that. And then, of course, we have our Community Core website. So some of the things that you will find on our website, we have free resources that link you to trustworthy health information websites. We also have a tutorial that was actually developed by the National Library of Medicine. It's available to all of you. It's a PowerPoint, and it goes through and it teaches you what to look for on a website. What are some things that might be concerning to you? So they create they're both fictitious, but a website that's well done, that truly is very clear, and one that's fake that actually is trying to get your information. So it's a really nice method. You could use it for teaching or for your own knowledge. So we'd like to refer you to that, and the link's on our website for that. We also have a calendar of events. So we try to post free community events that promote health and wellness for you. So those are the type of things that you'll find on our Community Core website. And now we just want to say thank you. Thank you. We know that all of you are so busy, and we really appreciate you taking your time. We would be delighted at this time to entertain any questions or any comments from any of you about health misinformation. Yes.
Yeah. So, when we look at different articles to get evidence, a lot of times it may be the sponsor of a product, the vendor, and the community or someone who's working with can take that and say, see, it really does work within, there's a lot of other evidence behind it. Can you give some feedback or discussion around that topic about what to look for around who's producing the evidence?
Yeah, that is a great question, Dr. Moore. So Dr. Moore asked about when there's a research study and it potentially is studying, let's say it's an experiment, experimental design, and it's looking at the effectiveness of a product, but that product was developed by a company. How can a consumer determine whether or not there was any bias in the way that was constructed? When research studies are published, they need to state that. There's always something, usually it's either on the first page of the study or it can be at the last. And there will be a disclaimer if someone receives funding or sponsorship. Just like Jackie had said at the beginning of this, if we were sponsored by Medline, which we're not, people need to declare that. So whether it's in the written word or whether it's if someone's giving a presentation, if they're sponsored by GlaxoSmithKline, if it's a drug study, or they need to state that. And also in the conduct of research with the IRB, the sponsor cannot have anything to do with the results. They need to be completely removed, blinded. They're not doing the analysis. They can't see the two groups. They don't know who gets assigned. So that's a really great question.
You said it so much better.
Yeah, no. And the other thing I think it's interesting, Tammy, that you brought up, was maybe some of you have heard of the Cochrane collaboration, the Cochrane Library. It's really the gold standard of systematic reviews. Systematic review, there are people, researchers that come together, they pull all the research together and they pull the findings for us. So rather than looking at the results of one study, let's look at what the 20 studies say all together. They can do this mathematically with a technique called meta-analysis. What's interesting about Cochrane is that some of the feedback about Cochrane has been, it's really advanced language. And so it's hard to understand. And so what they're really making a concerted effort now is they now have a plain language summary, which is meant for consumers. So that's really helpful to know as well. And frankly, I like to look at that too. I like to see just cut to the chase because, sometimes the technical terms, you can get a little bogged down in the terminology. So that's a great resource to determine really the state of the science in an area that's written in an easy to understand.
Well, and it gets back to the health literacy question, right? So people are wanting the information and being able to see it in layman's terms makes so much sense. So I'm really excited about that. Look at that for themselves.
Thank you. It was a great question. Other questions, comments, or anything from the audience?
Yeah, I'm gonna grab this.
In the chat.
All right, so we had a question in the chat. They are asking, what are your thoughts and recommendations with regards to the recent CDC admission to misinformation and mistakes?
Am I back on? Okay, very timely question. I saw that yesterday.
Did
Someone's really up to date. Yeah, so the CD,
It was
yeah.
Brenda.
Yeah, it's literally came out yesterday. So they're addressing this as well. So we have the US Surgeon General, the CDC is now addressing this as well. So I really suspect this is going to be a very hot topic coming forward. So it's just been, we've learned so much through the pandemic and we have to do better. So I think the CDC is also stepping up to the plate. We also know that we have a health literacy expert that also, she's from Maryland, is very much behind the scenes influencing the CDC. So we're very excited that Dr. Bauer has been doing that as well, Cynthia Bauer. So we suspect that, who knows, maybe Dr. Bauer might be, she's a health literacy expert and might be helping with that as well. So thank you, Brenda, for that question, because you're absolutely right. It's coming up. It's very, very.
Yes, I would just add on that I appreciate the transparency, at least being able to put that out there, right, to look the public in the eye and say, we have to do better. And this did go on and moving forward. So lessons learned.
Well, in person, online. While we wait, in case any come in, someone's typing, I just want to take a second and thank you both for being here today. This was very informative. And I love hearing that you guys have a podcast. I think that's a great, newer mode of communication that I love hearing more people doing that. I did not know that. So on top of all your other great information, I was excited to hear that. All right. Any other questions? All right. I will keep my Zoom up for the chat box in case some people have some other questions that we'll put in there. But also thank you to everybody for attending. If you have an evaluation, please fill it out and then leave it up at the front desk up here if you wouldn't mind. I would greatly appreciate it. If you did not pick up an evaluation, let me know. We have some sitting right outside the door, so I will make sure you get one. And then for those on Zoom, you will receive it in an email, so you can also fill it out. So I guess, yeah, thank you all for coming. We'll hang out for a little bit in case any more questions come through, but
Thank you.
Oh.